Okay, so today we're taking a deep dive into something that I think a lot of our listeners might, well, have their eyes on, so to speak. Age-related macular degeneration,
Yeah.
AMD.
It is a big one, and you guys sent in some really fascinating sources on it.
Yeah, some really dense material, honestly. So what we want to do is break down what AMD is all about, what causes it, how does it show up, what should you be looking for, and then, of course, what can you do about it? What are the treatments out there? How can you manage it? That's the big question.
Right, and it's a lot to unpack for sure, but these sources really lay it all out, which is great. So hopefully, we can make it a little less intimidating and a little more manageable for everyone listening.
Exactly. And we'll be looking specifically at those two main types of AMD, right? Dry AMD and wet AMD.
Yep, those are the big ones.
Okay, so let's start with dry AMD. Sources say it's the way more common type, like 80 to 90% of AMD cases are dry.
Right. And this one's all about, well, kind of a slow and steady breakdown of the macula.
Okay, so the macula, that's the central part of your retina that basically lets you see details, right? Like reading, recognizing faces, all that.
Exactly. Super important stuff. So in dry AMD, that area starts to, well, wear down over time. And one of the key things we see with dry AMD is the development of these little yellowish deposits called drusen.
Oh, yeah, those. And one of the sources described it like slow tire wear, but on your macula. I thought that was a good way to picture it.
It is. It's like those deposits are kind of building up under the macula and slowly causing it to lose its ability to function properly. And here's the thing. In the early stages, you might not even notice any changes.
Really? So you could have it and not know?
Yeah, it can be pretty subtle at first. That's why regular eye exams, especially as you get older, are so crucial. They can spot those early signs, even if you're not having any noticeable symptoms.
So how about when it moves into that intermediate stage? What starts to happen with your vision then?
So in intermediate dry AMD, some folks might start to experience, maybe a bit of blurriness in their central vision, and they might have a little trouble seeing in low light. But again, even at this stage, it can still be pretty mild for some people.
Okay, so what about when it reaches late stage? The sources are pretty clear that there isn't really a treatment to reverse late dry AMD, right?
Yeah, unfortunately, that's true. Currently, we don't have a way to completely reverse the damage in late-stage dry AMD.
And that can be tough to hear, for sure. But the sources do talk about ways to manage it, to slow down the progression.
Absolutely. Even though we can't reverse it, we can definitely work to slow things down and make the most of the vision that's there.
So what are some of the main approaches to managing it?
Well, one of the key strategies is using specific dietary supplements. And there's one in particular that comes up a lot, the AREDS 2 formula.
AREDS too, yeah.
Uh-huh.
I've seen that mentioned.
Right. So it's not just some random mix of vitamins, It's a very specific combination of vitamin C and E, lutein, zeaxanthin, zinc, and copper. And all of those are there for very specific reasons based on, years of research.
So it's targeting like specific pathways in the eye that are involved in AMD.
Exactly. Studies have actually shown that this formula can help slow down the progression of the disease in some people.
That's pretty amazing. And I did notice that in some older information, they mentioned something called the AREDS formula about the two.
Good catch. Yeah, so the original AREDS formula actually included beta-carotene, but then research showed that beta-carotene might be risky for certain people, like smokers. So they updated the formula, got rid of the beta-carotene, and added lutein and zeaxanthin instead.
Oh, wow. So they actually changed the formula based on new research.
Yep, always learning, always evolving, right? Science never sits still.
That's reassuring. So the supplements are important, but what else can people do to manage dry AMD?
Well, lifestyle choices definitely play a huge role, like eating a healthy diet, lots of fruits and veggies, that kind of thing.
Makes sense.
And quitting smoking. If you smoke, quitting is one of the best things you can do for your eye health and really just your overall health.
Yeah, smoking is like the villain in so many health stories.
It really is. And then there's protecting your eyes from the sun, wearing sunglasses, especially those that block UV rays, and keeping your blood pressure and cholesterol levels in check.
All those things you hear about for general good health anyway.
Exactly. A lot of it overlaps. And then, some of the sources specifically mention the benefits of a Mediterranean-style diet.
Oh, right. What's that one all about again?
So it's basically a diet that's high in fruits, vegetables, whole grains, and healthy fats, like olive oil, nuts, fish. It's been linked to a whole bunch of health benefits, and it might be helpful for AMD too.
Interesting. So all in all, it sounds like a lot of common sense healthy habits.
Pretty much, yeah.
And what about for people who are already experiencing vision changes from dry AMD? What can they do to adapt?
So there are actually a lot of great tools and resources out there. Things like low vision aids, which can be really helpful, magnifiers, special glasses, things like that. And then there's assistive technology, which can do all sorts of things like read text aloud, magnify screens, even help with navigation. And there's also vision rehabilitation therapy.
What's that?
Basically, it helps people learn new ways to do everyday tasks, even with vision loss, like cooking, getting dressed, using public transportation, all that.
So it's like retraining your brain to use your remaining vision as effectively as possible.
Exactly. And then, of course, there are support groups and counseling because, adjusting to vision loss can be tough emotionally.
Yeah, for sure. It's great that there's all that support out there.
It is. And, another thing that's exciting is that there's a lot of research happening on potential new treatments for dry AMD.
Oh, like what?
Well, gene therapy is a big one that's being looked at, and stem cell therapy.
Stem cells. I've heard about that.
Right. So one of the sources actually highlighted this really interesting study by a team at the National Eye Institute. They were able to treat dry AMD in animals using stem cells.
Whoa.
Yeah. And now they're actually starting human trials. It's still early stages, but it's definitely promising.
That's really encouraging to hear. Okay, so we've covered a lot on dry AMD. Let's switch gears and talk about wet AMD. Sources say it's less common, thankfully, but it tends to be a lot more aggressive in how it affects vision.
Definitely. Wet AMD is definitely the more, dramatic one, you could say. It's all about the growth of abnormal blood vessels under the macula.
So new blood vessels, but not the good kind.
Right. These blood vessels are leaky and they start to leak fluid and blood, which damages the macula. One of the sources described it like wild vines growing under your macula, which I thought was a good way to picture it.
Yeah, that's pretty vivid, and it doesn't sound good.
It's not, unfortunately, because all that fluid and blood distorts your central vision, and it can happen really fast.
Oh, so that's why it's considered more aggressive.
Exactly. And here's another important thing to know. Wet AMD can actually develop from any stage of dry AMD. So you could start with dry AMD, and then it could progress to wet AMD.
Oh, wow. So it's not like they're two completely separate things.
Nope. They're definitely connected, and that's why those regular eye exams are so important, because if you can catch it early, you've got a much better chance of preserving your vision.
So what are the symptoms of wet AMD, or really late-stage AMD in general?
Yeah.
What should people be looking out for?
So with late-stage AMD, which includes both the wet form and advanced dry AMD, the big one is if straight lines start to look wavy or distorted. Like if you're looking at a door frame and it suddenly seems kind of bent, that's a major red flag.
Oh, wow. That's definitely something you'd notice.
You would, and you should call your eye doctor right away if that happens. Other symptoms can include having a blurry spot in the center of your vision, which might get bigger over time. Colors might seem less bright, and you might have trouble seeing in dim light.
Okay, so definitely some noticeable changes. And the good news is, for wet AMD, there are treatment options available.
Yes, absolutely. And the main one that's used these days is anti-VEGF medication.
Anti-VEGF. Break that down for me.
So VEGS is a protein in your body that basically tells your body to make new blood vessels, which is fine, when you need new blood vessels. But in wet AMD, there's too much VEGF activity, and it's causing those leaky blood vessels to grow.
Ah, okay.
So anti-VEGF medication is basically designed to block VEGF. It's like turning off that signal that's telling those bad blood vessels to grow.
I see. And how is it given?
It's actually injected directly into the eye.
Whoa, in the eye.
Yeah. I know it sounds a little scary, but it's a pretty quick procedure and it's very effective. And there are several different anti-VEGF drugs out there.
Like what?
Well, some of the ones your sources mention are aflibercept, that's Eylea, and ranibizumab, that's Lucentis, and bevacizumab, which is Avastin, and then there's faricimab, which is Vabysmo, and brolucizumab, which is Beovu.
Wow, that's a lot of names.
I know, right? But they all basically work the same way. They block VEGF and help to stop those leaky blood vessels from growing.
So anti-VEGF injections are the main treatment for wet AMD. Are there other options too?
There are a couple of others. One is called photodynamic therapy, or PDT.
PDT, okay.
Yeah. So for PDT, they first inject a light-sensitive drug into your arm. Then they shine a special laser light into your eye, and that activates the drug, which then helps to destroy those abnormal blood vessels. It's kind of like a two-pronged attack,
Interesting. And what's the other one you mentioned?
Laser thermal therapy. It's basically using a laser to seal off the leaking blood vessels directly. It was one of the first treatments for wet AMD, but nowadays it's not used as much, especially since anti-VEGF injections have come along.
I see. So those injections are kind of the gold standard now?
Pretty much, yeah. They tend to be the most effective and have the fewest side effects.
And speaking of side effects, the sources do mention that there are some potential risks with wet AMD treatments.
Right. I mean, like any medical procedure, there are always risks, right?
Sure.
So with wet AMD treatments, some of the things to be aware of are the possibility of infection, retinal detachment, some structural damage to the eye, and then there's a chance of developing cataracts more quickly. And in rare cases, there's a risk of severe vision loss.
So definitely some serious stuff.
Yeah, for sure. And that's why it's really important to have a good conversation with your doctor about the risks and benefits before you start any treatment.
Absolutely. Okay, so now let's talk about diagnosis. This is relevant for both types of AMD, right?
Oh yeah, definitely. For both dry and wet AMD, early detection is super important. It's really the key to managing it effectively.
And the sources emphasize regular eye exams,
Yeah.
especially for people over 50.
Yeah. Once you hit 50, it's recommended to get a comprehensive dilated eye exam every year.
Dilated?
Yeah, so they put these drops in your eyes that make your pupils bigger so they can see the back of your eye more clearly.
Oh, I've had that done before.
Yeah, it's not too bad. And it lets them really get a good look at your retina and the macula so they can check for any signs of AMD, like those drusen we talked about earlier.
Right, right. And are there other specific tests they might do if they suspect AMD?
Yeah, definitely. There's angiography, where they inject a dye into your bloodstream to see the blood vessels in your eye. That's especially helpful for diagnosing wet AMD.
Okay. And then there's, I remember seeing this in one of the sources, the Amsler grid.
Yes. The Amsler grid, it's basically just a grid of straight lines, like a checkerboard. And you use it to check your central vision.
How does that work?
Well, you cover one eye and focus on the center dot, and then you see if any of the lines look wavy or distorted or if any parts of the grid are missing. And then you do the same thing with the other eye. It's actually a really simple test, but it can be really helpful for detecting early signs of AMD.
So you can even do it at home between doctor's appointments.
Exactly. And you should. If you notice any changes, definitely call your eye doctor.
So simple, but so important. What about other tests?
There's OCT, which stands for optical coherence tomography. It uses light waves to take really detailed pictures of the back of your eye.
Wow, high tech.
Yeah, it's pretty cool. And it can show things like how thick your macula is and whether there's any fluid buildup.
I see. And is there anything else?
There's also OCTA, which is optical coherence tomography angiography, and that one, it uses laser light reflection to make 3D images of the blood flow in your eye. And you don't even need dye for that one.
So angiography maps the plumbing, and OCT scans the actual tissue.
That's a great way to put it, yeah.
So all these tests help doctors diagnose and monitor AMD. But what about risk factors? What makes someone more likely to develop it in the first place?
So there are several risk factors that the sources consistently mention. Age is a big one, of course. The older you get, the higher your risk. And then family history. If you have a parent or sibling with AMD, your chances are higher.
Genetics.
Yep. And then ethnicity plays a role too. Caucasians tend to have a higher risk of AMD than other groups. And smoking. Smoking is a big one.
Of course.
And then being overweight or obese, having high blood pressure, and eating a diet that's high in saturated fat.
So basically, a lot of the things that are bad for your overall health are also bad for your eye health.
Pretty much, yeah. It all ties together.
Okay, so knowing those risk factors, what steps can people take to try to prevent AMD or at least slow it down?
Well, a lot of it goes back to those healthy habits we talked about earlier. Not smoking, maintaining a healthy weight, eating a good diet, exercising regularly, managing your blood pressure and cholesterol. All those things can make a difference.
And specifically for the diet, we talked about the Mediterranean diet earlier. Is that a good one to focus on?
Yeah, that's a good one. Lots of fruits, veggies, whole grains, healthy fats. And it's been linked to a lower risk of AMD in some studies.
Great. So even though there's no guaranteed way to prevent AMD, there are definitely things people can do to stack the deck in their favor.
Absolutely.
Now, let's shift gears a bit and talk about what it's actually like to live with AMD. Because, it's one thing to talk about symptoms and treatments, but it's another to understand the real-life impact.
Yeah, for sure. And living with vision loss from AMD can be challenging, there's no doubt about it. It can affect your ability to do so many things that you normally do without even thinking about it, like reading, driving, recognizing faces.
Yeah, I can imagine that would be really tough.
It is. But it's important to remember that AMD usually only affects your central vision. Your peripheral vision or side vision is usually okay, so you don't typically go completely blind from AMD.
That's good to know.
And there are also a lot of resources available to help people adapt to vision loss, like the low vision aids and the vision rehabilitation therapy we talked about earlier. Those can make a huge difference.
Right, right.
And one other thing I wanted to mention. One of the sources talked about Charles Bonnet syndrome. It's a condition where people with vision loss sometimes start to see things that aren't really there, like hallucinations.
Oh, wow. That sounds kind of scary.
It can be, yeah. But it's important to understand that it's actually a pretty common side effect of vision loss, and it's not a sign of any kind of mental health problem. It's just the brain trying to make sense of the missing visual information.
I see. Well, it's good to be aware of that. So overall, the message seems to be, yes, AMD can be a serious condition, but there's a lot that can be done to manage it and live well with it.
Absolutely. Early detection, healthy lifestyle choices, available treatments, and supportive resources, they can all make a huge difference.
Okay, so before we wrap up, there was one more interesting thing I wanted to touch on. One of the sources brought up fasting, specifically intermittent fasting and Islamic fasting. It wasn't directly about AMD, but it was mentioned in the context of overall health.
Oh, right. Yeah, I saw that too.
So just to clarify, intermittent fasting, that's the one where you cycle between periods of eating and not eating, right?
Right. Like the 16-8 method, where
Yeah.
you fast for 16 hours and eat within an 8-hour window. It's become pretty popular, and there's some research suggesting it might have benefits for weight loss, blood sugar control, reducing inflammation, things like that.
Okay. And Islamic fasting, that's tied to religious practices, right?
Exactly. It's a central part of the Islamic faith, where Muslims abstain from all food and drink from dawn until sunset during the month of Ramadan.
So different motivations for those two types of fasting.
Yeah, definitely. Intermittent fasting is often more about health goals and weight management, and it's usually more flexible in terms of the timing and how long you fast for. While Islamic fasting is primarily a religious observance with specific rules and guidelines.
And the source kind of compared the two.
It did. It suggested that Islamic fasting, because it involves complete abstinence from both food and water during fasting hours, might be considered by some to be more beneficial for overall health.
Interesting. But it also acknowledged that intermittent fasting might be a better fit for some people, depending on their lifestyle and individual needs.
Right. And the source also made a point about Islamic fasting potentially being a valuable practice for people who might not have easy access to healthcare or who live in poverty. It suggested that for those individuals, it could be a way to improve their health without any cost.
And even suggested doing it for like 6 days a week.
Yeah, abstaining from food and drink, except on Fridays.
Mm.
But again, this was all presented in the context of general health and well-being, not specifically as a treatment or preventative measure for AMD.
Right, that's an important distinction. But it's interesting to see how those different approaches to health were woven into the conversation about AMD.
Yeah, it definitely shows how interconnected our health really is. Everything affects everything else.
So true. All right, well, I think we've covered a ton of ground today on AMD. To sum it up, AMD is a common age-related condition that affects central vision. There are two main types, dry AMD and wet AMD, and they have different characteristics and treatments. Early detection is absolutely crucial, so everyone, especially if you're over 50 or have any risk factors, please get those regular eye exams.
Couldn't agree more. Those checkups are so important, and even though there isn't a cure for dry AMD, especially in the later stages, there are treatments to slow down its progression. And for wet AMD, we've got those effective treatments like anti-VEGF injections that can really make a difference. And for both types, healthy lifestyle choices and those support systems we discussed, those are crucial for helping people manage AMD and maintain a good quality of life.
Exactly. And on that note, here's a final thought for you all to chew on. We've talked about how lifestyle choices can influence AMD risk and progression. And we even touched on fasting and its potential impact on overall health. So what other things can you do maybe outside the traditional medical realm to support your health and maybe even impact those age-related conditions like AMD? Think about it. What else can you explore to really take charge of your well-being? Food for thought, right?
Yeah.
And thanks for joining us for this deep dive. We'll catch you next time.
See you then.